Hello, everyone. Myself, Dr. Yashika Arora Malhotra, welcomes all our respected speakers, chairman, and CEO Kavita ma'am, CA volunteers, and all the attendees to CA webinar. I would like to take the opportunity today to introduce CA Homeopathy Study Group to all of you. CA Homeopathy Study Group Bono was organized and founded by homeopath and humanitarian Kavita Kukunur, President and CEO of Kavita Holistic Approach on May 5th, 2020. This study group is intended to be an offering from Kavita to the homeopaths around the globe, sharing goodwill and solid clinical work within the classical model, are foundational principles for the CA. Our mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars which are based on principles of classical homeopathy and provide professional continuing educational homeopathy credits for the practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita is a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is nationally board certified by Council for Homeopathic Certification (CHC) and HNA CPD provider and serves as the associate editor for the Homeopathic Heritage. She is the Nash mentor for North American Society of Homeopaths and lifetime member of NCH, that is National Center for Homeopathy. She is also the recipient of Martha Allman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Linga Raju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. TANA, that is Telugu Association of North America, a prestigious organization, honored and awarded her for selfless homeopathic and humanitarian services at Delhi at Ladies' Night Out on October 2022, Michigan. Also, Dr. Kavita received the prestigious legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Dhan Singh Rawat, Senior MLA Mr. Harbhajan Singh Chima, the ex-director Homeopathy, the government of Uttarakhand and ex-chairman of HomeoCure and Research Institute during National Homeopathic Seminar, Homeopathy, the Future Medicine at Kashipur on 21st August 2022. Dr. Rajni Sharma, CA advisor, and Dr. Shweta Singh, CA chief administrator, CA team, were also recognized and presented with legendary homeopathy award at the ceremony. We are also proud to announce that Dr. Kavita was honored the Woman of the Year 2023 from prestigious organization NATA USA. Dr. Kavita was also honored by renowned DTA, Detroit Telugu Association Executive Committee on Mother's Day at Michigan, USA, the DTA Community Service Award 2023. She also received Lifetime Achievement Award 2023 by HomeoCure and Research Institute Director Dr. Rajneesh Kumar Sharma, CA Homeopathy Study Group, Kevin Friendly Foundation, in presence of Chief Guest Dr. Shripad Hegde, so giving best wishes from Homeopathy 360. We are extremely happy and proud that we celebrated 14 years of her book Beyond the Limits, A Challenge to Prove Oneself, and her second book, A Dose of Spirituality, has also completed 3 years on 22nd Jan 2025, which is launched in the presence of the honorable guest of Speakers American Institute of Homeopathy President Dr. Ellis Becker and Council for Homeopathy CHC President Dr. Sheetal Tiwari at our CA webinar. At CA's second annual celebration, our honorable guest of speaker Dr. Jwar Shah, Chairman of Enlightenment Education, launched its audio version and hard copy. We have also donated over $1,500 to 10-15 charities within 1 year, which we have also listed on our website. As of now, we have nearly 600 recordings on professional webinars related to homeopathy, health-related topics, and inspirational talks available on our channel, Kavita Kukunur. So you can visit the same. This webinar is being moderated by me, Dr. Yashika Arora Malhotra from CA family, myself, and it is it is being recorded as we speak, and we'll take the questions at the end of the webinar. We'll also post the jot form in Zoom webinar chat, at the end of the webinar. Please fill the form to receive the certificate. And you're requested to mute yourself and turn on your video off for better connections. Before starting the scientific session, I would like to read a code of ethics. Ma'am, can you please share the code of ethics on screen? Or should I share?
You can share, Yashika, if you have.
Okay, ma'am. Okay. Is it visible, ma'am?
Yes.
So we have the ethics and benefits that to be a car speaker needs at least 1 to 2 months active volunteering. Only car speaker themes are promoted in newsletters and webinars. Car provides volunteering for 2 to 12 months, respects and inspires volunteers to grow. Active volunteers will be promoted through our website, social media, and added to WhatsApp group. The articles of volunteers will be posted on car website and newsletter and will be sent for publication at other journals too. The volunteers and speakers are eligible for prestigious car annual awards. The volunteers are eligible for car inspirational talks. Volunteers are eligible for the case discussions. CA promotes homeopathic organizations as well as their mega events. CA promotes the great work of speakers through their book reviews. Honorable guests may propose their future courses or events after the webinar. CA maintains a healthy and happy environment, so keeps only like-minded folks. CA also requests everyone to maintain the confidentiality of the group. You can visit us at www.kavithahomeo.com.
Hello everyone, welcome to Ka Homeopathy Study Group Pro Bono webinar. Good morning, good afternoon and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, always thank Universe for giving us this great opportunity. And Dr. Shweta Singh, our Ka Chief Administrator, will start the session.
Thank you so much, ma'am. I Now I think we should start with the session. But let's welcome. Before that, I would like to welcome our honorable speaker of the day. Let me introduce her to you all. Today we have with us Dr. Shweta Singh, ma'am. She is a highly qualified homeopath who has been working as a research associate at Central Council for Research in Homeopathy, Ministry of Ayush, Government of India. She is also the branch head and the senior consultant of Orbit Clinics, Janakpuri, New Delhi. She brings with her a rich experience of more than 10 years and expertise in treating many difficult cases like gynecological disorders, dermatological cases, hypothyroidism, psychological disorders, etc. She is the chief administrator of Cow Homeopathy Study Group USA and also the former first female president of Delhi Homeopathic Medical Association, which was founded in 1932 by Dr. Yudhvir Singh, the first health minister. She's also the president of Rashtriya Atal Health Association, Delhi State. She graduated her BHMS from Baxan Homeopathic Medical College, Delhi NCR, and completed her MD in homeopathy from Shri Guru Nanak Dev Homeopathic Medical College, Ludhiana. She's also completed a PG diploma in health promotion from National Institute of Health and Family Welfare, New Delhi. And currently, she's pursuing PhD in homeopathy from a reputed university. She's also the chief editor of the Hahnemannian Homeopathic Sandesh General by Delhi Homeopathic Medical Association. Also, she's the associate editor of the Homeopathic Heritage by BJ Publishers India. She had an experience of actively working in the field of drug addiction with the aim to explore the effectiveness of homeopathy in drug addicts and psychiatric patients to build a healthy drug independent society in an NGO named Muskan Foundation. She underwent training from Department of Psychiatry, AIMS, uh, on management of substance use of disorder, organized by National Drug Dependence Treatment Center, National Institute of Social Defense, and Ministry of Social Justice and Empowerment, Government of India. She has an experience of teaching as well. Since she worked as on the post of assistant professor in the Department of Organon of Medicine and Homeopathic Philosophy in a reputed medical college. She has been a national and international speaker and the author of numerous national and international research articles published in various peer-reviewed journals. She is the recipient of many international and national awards, and recently she has been awarded with the legendary homeopathic award, a legendary homeopath award from the Health Minister of Uttarakhand, Shri Dhan Singh Rawat, on 21st August 2022 in the first National Homeopathic Conference in Uttarakhand, and Ka Hahnemannian Award from Ka Homeopathy Study Group, USA, in May 2023. She'll be speaking on the topic Individualization in Psoriasis, a homeopathic perspective. We welcome you, ma'am, to the CAR platform. Please proceed with your session.
Thank you, Dr. Yashika. Before beginning the session, I would like to read the disclaimer. Yeah. All the KHA Homeopathy Study Group webinars are for educational purposes only and not intended to diagnose or treat a disease. Listeners can benefit with the information shared at the webinars. The opinions expressed by speakers, moderators, and attendees are part of the educational experience and do not necessarily represent the position of the Kavita Holistic Approach, KHA or KHA Homeopathy Study Group Pro Bono. Thank you. And I would also like to thank Dr. Kavita for this opportunity to present on the topic psoriasis. Let me share my screen. I hope the PPT is visible. So today's topic is individualization in psoriasis, a homeopathic perspective. Psoriasis is a multi-system disease predominantly affecting the skin and the joints, and it is a chronic and immune-mediated inflammatory cutaneous disease, affects over 60 million adults and children worldwide. So psoriasis is no longer considered as merely a skin disorder. It is now recognized as a multi-system inflammatory disease that can affect several organs, and particularly the skin and the joints. While the characteristic skin lesions are the most visible manifestation, but many patients may also develop joint involvement in the form of psoriatic arthritis. You all know that, and may have associated systemic comorbidities. So it is a chronic inflammatory immune mediated disease, meaning that abnormalities in the immune system trigger persistent inflammation, and this inflammatory process leads to the development of typical erythematous scaly plaques, which is seen in psoriasis. Globally, it affects more than 60 million people, including both adults and children, making it a significant public health concern. And the disease can occur at any age and often has a considerable impact on the quality of life due to its chronic and recurrent nature. One of the key pathological features of psoriasis is its hyperproliferative of the epidermis. In normal skin, basically epidermal cells mature and reach the skin surface, over approximately 28 to 30 days. In psoriasis, this process is dramatically accelerated and occurring within 3 to 5 days. As a result, the immature skin cells accumulate on the surface and producing the characteristic thick silvery scales. So this increased epidermal turnover is not a primary defect of the skin itself, but it occurs secondary to the inflammation within the dermis. And the activated immune cells release inflammatory mediators and cytokines, and that stimulate the excessive growth and abnormal differentiation of the keratinocytes, leading to the visible skin lesions. Thus, psoriasis represent a complex interaction between the immune system, the dysregulation in the immune system, inflammation, and the abnormal skin cell proliferation, highlighting its nature as a systemic inflammatory disease rather than a purely cutaneous condition. Now, the risk factors or the triggering factors are: it is found genetically predetermined disease, and it is partly determined by the immune factors and the environmental exposures. It does not manifest itself in absence of any environmental trigger like stress, infection, particularly streptococcal, alcohol consumption, smoking, drug exposure, such as lithium, antimalarial drugs, NSAIDs, and in some cases, sunlight, obesity, and weight gain. Flare-up of the psoriasis can also be triggered by trauma, winter season, infections, drugs, and a compromised immune system. So these are the risk factors which can aggravate psoriasis or which can trigger the psoriatic plaques. There are various forms of psoriasis, some of which we will be discussing now. Plaque psoriasis or psoriasis vulgaris, which is the most common and most easily recognized psoriasis form of psoriasis. The lesions are well demarcated. Salmon pink plaques will be there, which is covered in silvery or gray scales. Anatomical symmetry of the plaques is the characteristic of psoriasis vulgaris. And the commonly affected sites will be extensor aspects of the knees and elbows, the lumbosacral region, the scalp, rarely encroaching much beyond the hairline, although any skin surface can be involved. Next is sebopsoriasis. Looks like seborrheic dermatitis or dandruff, and the common sites will be scalp, eyebrows, nasolabial folds, post-auricular and presternal areas. Pustular psoriasis, which is very uncommon, and the characteristic is the sterile pustules and the erythema. Then the generalized pustular psoriasis or von Zumbus disease, that is more common in women than in men, and it is an autoinflammatory disease which is associated with periodic flares, sterile pustules, pyrexia, and it can be life-threatening. Next is palmoplantar pustulosis, which is common in middle-aged and female smokers. It is presenting itself as sterile yellow pustules revolving over several weeks to red or brown macules. And the common sites are palms and soles. Next is acrodermatitis continua of Halopio. It is very rare and characterized by pustules, which can lead to shedding of the nail plate, and it is approximately 40% of the affected individuals have concomitant chronic plaque psoriasis. Common sites are distal portions of the fingers and sometimes toes. Then erythrodermic psoriasis, which is a life-threatening condition affecting approximately 2 to 3% of adults. Confluent erythema will be there, or exfoliation of fine scales will be there, associated with pruritus and pain. More than 75% of the total body surface area involved in this kind of psoriasis due to hypothermia, high output cardiac failure, and electrolyte imbalance. Then gutted psoriasis, which constitutes 2% of all cases. Numerous small drop or dot-like and scaly papules will be distributed in a centripetal pattern, mostly resolved spontaneously in several weeks or months. Approximately 40% of the cases progress to chronic plaque disease. Then the inverse or flexural psoriasis, which is presented as shiny red without the characteristic scaling, and it can be mistaken for candidiasis or tinea infection. It looks like candidiasis or tinea infection, and it mainly affects the flexural surfaces and involves the skin folds such as axillary, inframammary, inguinal, and intergluteal areas. Then the nail psoriasis, which presents in approx 50% of the people with plaque psoriasis, and presentations can be varied from small pits on single to all 20 nail plates. Nail plate separation from the nail bed, termed as oncolysis, oil spots or on nail bed, or dystrophy of the nail plates. The presence of nail disease, particularly oncolysis, is associated with a double risk of psoriatic arthritis and with longer disease duration than in patients with psoriasis without nail disease. Now the diagnosis. Basically, the diagnosis of psoriasis is primarily a clinical diagnosis, which means this that in most of the cases, it can be identified by a careful history taking and physical examination without the need of extensive laboratory investigations. The clinician evaluates the history of the disease, including the onset, duration, recurrence of lesion, family history, triggering factors, and associated symptoms, such as itching or joints involvement or joint pains. Along with history, the morphology and distribution of the lesions play a crucial role. Psoriasis typically presents as a well-defined erythematous plaque and covered with silvery white scales, commonly affecting the scalp, knees, elbows, lumbosacral region, and the extensor surfaces. So, although the clinical appearance is often characteristic, certain investigation may be required when the diagnosis is uncertain or when other skin condition needs to be excluded. Like we can go for KOH examination, potassium hydroxide examination to rule out tinea infection, where skin scales can be maybe examined microscopically after treatment with potassium hydroxide to detect fungal hyphae. And this will help to rule out tinea infection, which can sometimes mimic psoriasis. And serological testing can be done, blood test, to exclude the secondary syphilis as syphilitic skin eruptions, and can be occasionally resemble psoriatic lesions. And you can go for skin biopsy. In atypical cases, a small sample of skin may be taken for histopathological examination, and this helps to differentiate psoriasis from other inflammatory or neoplastic skin disorders such as eczema, dermatitis, pityriasis rubra or filariasis, drug-induced skin eruptions, or cutaneous T-cell lymphoma. So for excluding such inflammatory skin disease, you can go for investigation. Then there are two important clinical signs that supports the diagnosis of psoriasis are Auspitz sign. Auspit sign basically refers to the appearance of multiple pinpoint bleeding spots when the characteristic silvery scales of a psoriatic plaque are gently removed. This occurs because in psoriasis, the epidermis becomes excessively thin over the elongated dermal papillae, where numerous dilated capillaries are present. So when the adherent scales are detached, these superficial capillaries are exposed and rupture easily, resulting in tiny bleeding points. And the other phenomena is Koebner's phenomena, which refers to the development of new psoriatic lesions at sites of skin injury or trauma. In susceptible individuals, even minor injuries or trauma such as scratching, cuts or abrasions, surgical scars, pressure from tight clothing, or friction from belt or waistbands may trigger the appearance of typical psoriatic plaques at the affected site. So this phenomena is particularly observed during the active phase of the disease, indicating ongoing disease activity. So you can go for these diagnostic signs to diagnose psoriasis. Then the treatment. Psoriasis is a systemic disease, as we have already discussed, and it is largely observed in adult population with psychological, metabolic, arthritic, and cardiovascular comorbidities. WHO itself recognized it as a chronic, non-communicable, painful, disfiguring, scaling, and disabling disease for which there is no cure, according to WHO. And in terms of treatment, identification of risk factors for general and lifestyle management, it requires a holistic and proactive approach. So homeopathy is the best treatment to be given in psoriasis patient. Now, the homeopathic point of view is skin diseases are, or psoriasis, is the outward expression of what is going on inside. So, definitely, although you are seeing the skin lesions outside on the superficial surface of your skin, but the cause is always within. The reflection of internal dyscrasia or disharmony. That means the skin eruptions or the psoriatic lesions are because of diseased vital force according to homeopathic point of view. And the skin serves as a mirror which reflects the condition of various internal vital organs. Skin diseases are not simple skin problems, but are the result of an underlying internal disorder, dynamic disease that appear on the surface of the body, but cause is always within, cause is always internal, causes the diseased vital force, causes the disharmony in the vital force. No disease can be local. So you are seeing your eruption outside, but the cause is the disease is not local. It is the internal dynamic disease. It is the outward expression of the inward and spiritual vital force. Now, the homeopathic treatment. If we talk about the homeopathic treatment, psoriasis is often perceived as a disease of the skin, characterized by visible lesions and chronic recurrence. However, as a homeopathic physicians, we recognize that behind every psoriatic plaque stands a unique individual with distinct susceptibilities, with distinct emotions, constitutional traits, life experiences, and patterns of reaction to a disease. Because we treat the patient with skin disease as a whole, not psoriasis, not any other skin lesion or parts or organs or systems. So the challenge before us is not merely to understand psoriasis as a pathological entity, but to perceive the person who manifests it. This is where the principle of individualization becomes the cornerstone of homeopathic treatment. While conventional approaches may focus on suppressing cutaneous manifestations, homeopathy seeks to comprehend the totality of the patient's symptoms and the underlying dynamic disturbance that gives rise to them. So today we will explore how constitutional assessments, miasmatic understanding, mental or emotional characteristics, and peculiar individual symptoms guide remedy selection in psoriasis. Through this discussion, we aim to reaffirm the timeless homeopathic principle that there are no diseases to be treated in isolation. There are patients to be understood in their individuality. So case taking, we do homeopathic case taking for individualization because Dr. Henneman wrote that no real cure can take place without a strict particular treatment for each case of disease. This statement forms the foundation of homeopathic case taking and remedy selection. In homeopathy, we do case taking with the objective to diagnose pathologically, to identify the disease condition such as psoriasis, and the second aim is to diagnose therapeutically, to understand the individual patient and determine the most appropriate remedy, the simillimum. So, to find out simillimum or to find out a homeopathic specific remedy, homeopathic specific remedy is not specific to the disease diagnosis. It is specific to a individual. So the cardinal principles of homeopathy is individualization, and we have to recognize that while two patients carry the same pathological condition, they do not experience or express the disease in the same manner. Like for example, they can be differ in the lesions can be differed in the location or the distribution. There can be difference in the itching pattern. The modalities can be different. The emotional and mental responses can be different. And associated complaints or the general symptoms can be different. So thus a physician attention is not confined to the disease level alone, but instead we have to emphasize on the individualizing characteristic symptoms. The more striking, singular, uncommon, peculiar characteristic signs and symptoms of the case of disease, because they are the chiefly and most solely to be kept in view to find out the medicine, the appropriate, the most similar remedy. You can find out the general and undefined symptoms in all of the cases, but they are the symptoms of the disease. But you have to find the symptoms of the individual. You have to individualize each case with the same disease. Now, the selection of simillimum is totally depend upon the totality of the symptoms, which is to form a totality is not a mechanical process of merely collecting a large number of symptoms, but it is the quality, the characteristic nature of the symptoms and the individualizing value. So the physician must evaluate which symptoms truly reflect the patient as a whole. Particular importance is to be given to the characteristics, mental or emotional symptoms, to the modalities, to the general symptoms, to the peculiar uncommon symptoms, striking features if there are any with the psoriasis, or individual reaction of the disease. Many symptoms may belong to the disease, itself and can be common in most of the patients. So these symptoms have limited importance value in the remedy selection. We have to distinguish one patient from another with the help of the individual characteristic peculiar symptoms, and we have to, with the help of those symptoms, we have to construct the totality. So the totality of the symptom should represent the unique expression of disease in any individual. In aphorism 7, Dr. Henneman wrote that as in a disease form which no manifest, exciting or maintaining causa occasionalis has to be removed, we can perceive nothing but the morbid symptoms. So we have to also take care of the exciting or maintaining factors in a case. After proper management of the case, after proper removal of exciting or maintaining causes in a case, the left out symptoms, the rest of the symptoms can make the totality. Those are the symptoms which require medicine. And those are the symptoms which are outwardly reflected picture of the internal essence of the disease, that is the affection of vital force. And those are the symptoms which must be the principle or the sole means whereby the disease can make known what remedy it requires. Those are the symptoms which can lead you to find out your the most similar remedy. So, in homeopathic prescription, the totality of the symptoms must be the principle. How we can make the totality? We have to consider the location, the morphology of the lesions. We have to consider the patient as a whole. His physical characteristics should be included. Mental, emotional, social characteristics to be included. We have to ask the patient about everything. Now, if we talk about the homeopathic literature, the commonly used repertory of the homeopathic materia medica by Dr. J.T. Kent mentions psoriasis as rubric, eruption psoriasis in the chapter skin with 52 drugs, whereas in synthesis, 65 more drugs in this rubric you can find. If we talk about the external application, it may seem as if cure process of a local disease could be accelerated with correctly chosen homeopathic remedy internally as well as externally, selected on the basis of totality of the symptoms. It might possible produce a more rapid involvement, but it is neither beneficial in acute diseases of rapid growth nor in those of long standing. So there is no use, or it is neither beneficial in the cases of psoriasis to use a remedy externally as a local application, even if the medicines were specific and curative in that form. Why? It is entirely objectionable treatment. It can cause premature disappearance of the local symptoms, but the disease can be present internally. But you won't be able to see that infection is present. There will be retrograde change and the disease will grow more worse and graver internally. And it will be difficult to assess that the disease is being totally exterminated. So please avoid external treatments or application of the medicine in case of psoriasis or any other skin lesions. Now, let me present some of few of my cases. This is case 1. Mr. G, aged 40 years, consulted me for his scalp psoriasis for 13 to 14 years. He had itching, bleeding after scratching, sticky watery discharge from eruptions, which aggravates in rainy and winter weather. At first, the pustular eruption over occiput, then scaling and itching, also complaining of hyperacidity, burning sensation, and in abdomen. He had dog bite at the age of 11 years And in the family history, his father had tuberculosis. His grandmother and uncle also had scalp itching and psoriasis, respectively. In the physical generals, his thirst was decreased, though dryness of mouth was there. And there was desire for spicy food. He showed sensitivity towards cold weather, cold air, thermal reaction was chilly, and sleep was disturbed due to work, unrefreshing sleep. Tongue was found to be coated white. In his mental generals, the patient was calm, very much loving and caring to his family. On the work front, he is very hardworking and stressful, only related to his work. He also had great fear of water. There is fear of dog to some extent. And we made this totality: skin eruption, psoriasis, itching, where scratching aggravates, desire for pungent things, white coated tongue, dryness of mouth, great fear of water, and he's industrious. On the basis of repertorization, the phosphorus coming up as a high grade remedy, the first ranked remedy. So we gave phosphorus to this patient, phosphorus 200 single dose, and followed by rubrum met 30 TDS for 15 days. He was under the treatment for around a year, and calcarea carb was also given because because of his hyperacidity or some of few symptoms which are matching his personality. Calcarea carb was also given as an intercurrent, and in this 1 year duration, he was found to be better in his scalp itching or psoriatic eruptions. Now, the next case, a male patient aged 52 years came to OPD in March 2021 with the complaints of severely dry, cracked skin of hands and soles, which you can see in the picture. And he was using allopathic ointment, sopramycin, on and off without any relief. And there is itching, and the patient has tendency to pick skin constantly. In the physical generals, patient had strong desire for sweets, an aversion to tea. Tongue was found to be coated white. Thermally, the patient was hot. Snoring was also present. And mental generals, he was very lazy, talkative, irritable, and the patient had an aversion to being washed. Basically, the patient appeared markedly unclean and neglected in personal hygiene. His soles were constantly dirty, suggesting a strong aversion towards cleanliness. During each consultation, I asked why he did not wash his feet, explaining that poor hygiene could increase his infection and his risk of infection. However, the patient was unable to provide any specific reason for this behavior, and notably during despite repeated advices and counseling, there was no change in his habit. And in particulars, there is dry, cracked, dirty, filthy skin on palms and soles. So this is the whole totality. And because the most prominent symptom in this case was dirty, filthy looking skin, the aversion to being washed, and desire for sweets, there was itching suppressed with the use of ointment. So on repertorization, sulfur is coming out as to be the most common medicine or the first rank remedy, which is covering all the symptoms. And because of his dirty, filthy behavior, I gave him sulfur 3 times in a day. And you can see with sulfur only in one month, this is the condition, this is the result with sulfur. Case 3, this is a case of 7-year-old boy came with his mother for homeopathic consultation in October 2024. Presented with psoriasis with a lot of scaling, you can see, and itching, which aggravate at night and after bathing and ameliorates by cold air. He was on allopathic treatment since April 2024, but without relief. You can see the condition of his skin. The scaling eruptions are all over his body, hands, back, front, chest, everywhere it is there. And associated complaints were dribbling of saliva during sleep, pain in multiple joints, brittle nails. In the physical journals, he was extremely hungry and he cannot tolerate his hunger. There was frequent urging for urine in drops, and he has to strain for urine for no pain, but offensiveness was there in urine. There was extreme thirst with dryness of mouth, desire for sweets and indigestible things like pica, rubber, and paper. The patient was thermally hot. Perspiration increased over scalp, and the frequency of stool was 4 to 5 times in a day. Has to rush to closet in morning every time after eating. These are his physical journals. In the mental journals, he was irritable on slightest trifles, throws things in anger. There was fear of injections, fear of dark. He talks in sleep, and he was forgetful. Weak memory was there, and he also had aversion to bathing. On the basis of this totality of the symptoms, we repertorized the case, and sulfur was coming out to be the first rank remedy. He was thermally hot, and desire for sweets was there, and aversion to bathing was there. So I chose sulfur in that case too. And we gave sulfur 30, only one dose, followed by rubramate 30, TDS. But in the follow-up, there was no relief in anything. The itching, the scaling, in fact, it increased after sulfur 30. So, because there was no relief, in fact, the case was aggravated after sulfur 30. So, I re-evaluate the case, and some more symptoms were observed, like blocked nose, aggravation at night, and there was observation like fan-like motion of the LNSI. It was also observed in the follow-up. The patient, that boy was very headstrong. He was very obstinate. Anger was there, which aggravate after contradiction. The patient seems to be very shy and timid in front of me. But after consulting his mother, it was found that there is domination towards his parents. He's very shy and timid in front of others, but dominating towards his parents. On the basis of these symptoms, I again re-evaluate the case. We can again refer the repertorization chart, and the second coming up remedy was lycopodium, which covered the blocked nose, aggravation at night, which covers the fan-like motion of the LNSI, and definitely his mental characteristics, that the shy and timid in front of others, but dominating towards parents, and covering the symptoms of desire for sweets, right? And the hot patient, everything. So in the next follow-up, after consultation, I gave him lycopodium 200, one dose. After following up the case, after 20 days, itching was relieved a little, and the scaling increased. And the stools, which was the frequency was 4 to 5 times in a day, it reduced to 2 to 3 times in a day. Urinary complaints were also a little better. So after 20 days, I prescribed lycopodium 1 mg, one dose, and followed it up with rubramate 30 thrice in a day. And I think the treatment was continued for 2 to 3 months, and I gave lycopodium one more time in between, 1 m potency, and you can see the results. All of the psoriatic lesions were disappeared with lycopodium 1 m. And now also the patient is in my contact, and he is totally free from this psoriatic lesions. His winters were fine. There was no recurrence of psoriasis in winters, in the weather, in chill weather, and he's doing good with lycopodium 1m. So this is from my side. Thank you so much. Over to you, Dr. Yashika.
Thank you so much, ma'am. Thank you so much. I would like to request the audience to please share your questions if you have any for discussion.
Yeah, good evening, Dr. Shweta.
Yes, ma'am, you can proceed.
Yeah, hi. I just had one question. Whenever we are giving sulfur, many a times we have, con like a lot of confusion whether this will give aggravation like you had. So, what is your opinion for new doctors who are having psoriasis cases for the first time? Like how to start with sulfur?
Yeah, Dr. Archana, I gave sulfur in many of the cases, but you can see in that child, in this case, I gave only 1 dose of sulfur 30. So if you are not that confident, you can restrict yourself with only 1 dose or the water dose. You can restrict yourself so that if you give a water dose, you can prevent that aggravation with the medicines.
Okay, so water dose, you mean to say like 4 pills in divided
In a
doses? Like,
glass, yes, in a glass of water in divided doses, or you can ask the patient to dissolve those 4 to 5 pills in a liter of water,
okay,
like this,
so
so that
yeah.
aggravation can be avoided. Yeah.
So it can be divided into 2 or 3 parts as you feel like that way, right?
Yeah, you can ask the
Okay.
patient to add those pills in a glass of water. You can ask them to take it to consume it in 2 to 3 hours. You can ask that way you can prevent that aggravation from any homeopathic medicine, or restrict
O-
yourself to use low potency. Don't go high if the mental generals are not matching, or if you're not that confident, so restrict yourself to the low potencies.
And in case, ma'am, if any aggravation happens, so what do we advise to the
We have
patient?
to wait. Or if
Okay.
there is, yeah, if the aggravation is very extreme, then you have to think of antidote of that remedy.
Acha.
You can consult
Okay.
Boric to choose
Okay, ma'am.
antidote, or you can reevaluate the case as I have done. After giving sulfur, I reevaluate the case. So the more symptoms are matching to lycopodium, then I go for lycopodium. So if you give the most similar remedy after reconsulting, after reevaluation of the case, you can, that the similar remedy can also antidote the previous medicines, the reaction of
Yeah,
previous medicine, I think.
yeah. Because some patients do understand, but some patients always are like very tricky that, whether to go back to the doctor when there is an aggravation. So that's
Yeah, you
why,
can prevent aggravation by sticking yourself to low potencies, or don't repeat the remedy if you're not confident about the
Mhm.
prescription. Just give
Okay.
1 dose, ask the patient to come tomorrow. We can
Yeah.
ask the patient for an early follow-up. This,
Okay.
like this, we
And
can manage in our OPD.
yeah, in the first case, actually, like it was really a miraculous result. Like 3 doses he gave, and like 30 potency, right? Morning, evening, afternoon. And in
Was
that first
in the
case,
second case you are saying, no? Sulfur 30.
sorry, yeah, second case, yeah, yeah.
Yes, yes. I gave TDS because that mental symptom of aversion to,
Two
aversion to
bathing,
being washed.
bathing. Uh,
Yes, that was very prominent. That was very striking.
okay, okay.
Yeah.
Nice session, Dr. Shweta.
Thank you.
Thank you so much, ma'am, for your wonderful question. Thank you, ma'am, for your very specific answer to the question. I would like to request if anybody has any other question, so they can post in the chat box, or they can just say. For the time being, I would like to thank our speaker of the day, presentation of on psoriasis, which is again recurrent and occurring again and again, uh, reoccurring again and again. We had wonderful cases today to learn. Also, I would like to take the privilege to honor our speaker with the KHA Appreciation Certificate. Please accept it from the KHA Homeopathic Group Study Group. Thank you for your gracious presence and sharing your knowledge with us. I'll just share uh, the certificate. Thank you so much, ma'am. Thank you, Dr. Shweta Singh, for being the honorable speaker on individualization and psoriasis homeopathic. Thank you. Um, if anybody has any queries, please put in the chat box. So also I would like to take this nothing. For we have another website. You can find the link to register at our website. Don't miss the webinar next month as well. I would also like to thank the viewers and the followers to join us today. We have many such informative webinars lined up in the upcoming sessions with many renowned homeopaths. And you can follow us on our social media handles for other updates. If you missed any webinar, you can also watch it on YouTube channel Kavita Kukunur. And I'm thankful to KHA volunteers for the continuous support and selfless services with which we are able to organize these webinars in a successful manner. You can reach to us at kstudygroup@gmail.com for any queries. Thank you, ma'am. Thank you. Shall we end the session for the day if nobody has questions? I've already shared the link of jot form for the certificate. You can fill the form and generate your certificate. Shall we end the session, ma'am?
Yes,
It was a
please.
wonderful case presentations. So thank you so much for enlightening us with a wonderful session.
Thank you, Yashika.
Thank you.
Thank you, ma'am.
Goodbye, everyone.